Sarcoidosis is a systemic illness. We don't know what causes it, and what happens is that there are what we call granulomas formed, and granulomas are collections of immune cells and undergoing a mechanism of inflammation, and so they can almost be sort of considered like little lesions or masses and tumors, and they can occur in any organ system. So, and after the inflammation, there can be a process of fibrosis or scarring that happens, and that becomes important in patients that have progressive disease. But usually when somebody contracts sarcoidosis, in most cases the disease stabilizes or it reverses, it remits. But unfortunately, in African Americans especially, it tends to be more severe and progressive. It's not a cancer. No, it's not a cancer at all. It is what we think to be fairly normal immune cells of the body that's driven to being aggregated in areas of particular areas of the body based on possibly a response to something it recognizes as foreign. And we have been able to identify some potential culprits. One is a possible past exposure to tuberculosis, because we know from studies, PCR studies, where we can replicate the most minuscule of material from a granuloma, that there seems to be some enzymes that we also find in tuberculosis. But that's not every case, and not every study has come through with the same information. But the most robust studies have shown, and the most reproducible studies have shown, that there might have been some exposure to tuberculosis in the past that may not have. But it's not infectious. I want to be clear about that. What it is the body's immune system responding to something. And so then there's also a question of chemical exposures and particulate exposures. The spectrum to which we are casting our attention is not simply limited to an exposure to some infection in the past, but actually other entities. So the most common organs that are involved tend to be the lungs and skin, eyes. We think other organs involvement is probably less recognized, and therefore we don't have a good accounting of those diseases. So folks may incidentally, on a chest X-ray, your doctor may say, "Oh wow, you've got some lymph nodes in your chest. Let's find out what this is." And then they biopsy it and find that it's granulomatous disease, and so they think perhaps it's sarcoidosis. But the patient has no symptoms, so then we just watch. And a lot of times those patients do regress. However, patients more often than not that present with symptoms have bad disease, and there's probably more of a likelihood of them having progressive disease. So they might present, for example, with shortness of breath or a dry, disabling cough. The other symptoms, and I think this is very important, just harking back to under-recognized organ systems, is shortness of breath or heart failure, especially in a young person. That is because sarcoidosis affects the heart, and we think it probably affects the heart in a clinically meaningful way more than we recognize. Other symptoms related to the eye, it can affect pretty much any area of the eye, so that it can involve the lacrimal glands, which produce tears. It can involve ducts. It can be associated with a glaucoma. Most commonly, though, it's associated with an inflammation of the eye we call uveitis.